Women of Reddit, what's something they never tell us about pregnancy and childbirth? Story 11, don't get too attached to your birth plan, because there's a good chance that the whole thing will go out the window at any given moment. 2, no one warned me about the catheter. Story 2, how animalistic the whole process is. If you have any fantasies about how special humans are, you will quickly realize that nope, we're just chimps with really short hair. Not a bad lesson really. Story 3, the sheer indignity of the whole process. Yours out for everyone to see, you get it out at every doctor visit. It's obviously out during childbirth, if you have a C-section. The time you are lying on your back after the spinal block, nursing are coming in and cleaning you up, all in your business. You can't move or help because you're basically paralyzed. Then if you breastfeed, you're out all the time. Motherhood really isn't for those that are modest about their bodies. Story 4, I shook like a leaf for about an hour after giving birth due to the adrenaline. I was shaking so hard, teeth chattering, not able to hold my baby for a little while. Story 5, there is no safe zone. People tend to think that once you get past the first trimester you're guaranteed a living baby. But that's not the case. Also that after loss, you still go through all things postpartum, just with empty arms leaking milk, bleeding, hormonal swings. Story 6, it hurt so much. I was told you won't remember the pain, Auntie Jeannie. I remember the pain 20 years later, how long you bleed after. Story 7, I feel like I was pretty prepared, but the one thing I didn't know about was how the nurses will massage your belly after giving birth to help the uterus go back down. I say massage, but it's more like aggressively kneading dough. Story 8, you may get back to your pre-pregnancy weight, but whether you return to your pre-pregnancy shape is a shoot. My hips stayed wide, even at my lightest. Postpartum depression can just not go away. I've been dealing with intractable depression since 3 days after my son was born. He's 18 now. You will not know how to breastfeed, which you've probably heard. Neither will your baby. They'll have a vague idea, but it takes practice to get it right. Demand equal help from your partner immediately and don't let up. He works all day. Well, guess what? So do you. All that breastfeeding and changing diapers and cleaning is work. You deserve breaks too. Take them, or assume you're doing fine without them. I felt like no one I knew told me about the first trimester exhaustion. I had it with both pregnancies. I literally felt like I did marathons daily for the first try, so sleepy no matter how much I slept. Tate drank. Story 9, you can get so exhausted in between your contractions that you can actually start to fall asleep, then you're shocked out of your droopy stupor by the next one. Story 10, former postpartum nurse here, now working in pediatrics, but the number of moms I would take care of that when breastfeeding were so distraught they weren't producing enough milk and so became convinced they couldn't breastfeed was too many. It usually takes about 3 to 5 days for milk to really come in. Until then you're really only producing drops referred to as colostrum, and generally the baby doesn't need much more than that. Their stomachs are really only about the size of a marble. Also, it's not unusual in the first few days for babies' weight to drop a bit. They will lose ideally less than 10 of their birth weight, but gain it back shortly after. Story 11, your waters breaking feels like a balloon popped between your hips. Baby's kicks feel like a baby kicking you. The whole butterfly feeling lasts like a month tops, then it's just a whole kid kicking you from the inside out. It sounds magical. It get real old, real quick. Be prepared to be an absolutely certifiable lunatic. I'm not an emotional person. I don't have big feeling, and I certainly don't cry in front of strangers. But hey race, just a short list of some of the things that made me sob for minutes on end. Fried chicken was good. The cat meowed at a through the window. The Mars rover exists. A baby panda wasn't born that day. A dollar store plastic spatula bent. My husband said hello gorgeous. The store did have peanut butter ice cream. My ceiling fan was off when I wanted it on. Also, random strangers are going to touch you and ask you very weird, very personal questions. For some reason there is a segment of the population that seems to view pregnant women as public property, like a park bench or a stop sign, and feel that they have a right, a duty, to comment and offer completely unsolicited and wildly unhelpful advice at any time. Learn the art of embarrassing them back. It's hilarious. If your belly skin itches, it means your skin is stretching a ton. Put some goddamn vitamin E oil on and don't scratch. That's how you get those deep long stretch marks. Bath in that stuff. Story 12, postpartum depression and postpartum anxiety is real. You can hate and love too much that tiny human you just made. Sleep deprivation is not for the weak. It sucks and will never be easy. At least not until your child is a full night. Be communicative about your needs. Don't feel bad for asking for help and set boundaries with people who wants to visit. Story 13, C-section recovery. I didn't anticipate having a C-section, but after 20 hours of labor, we had an emergency cesarean. Nobody warned me about the recovery and how difficult it is to be recovering from abdominal surgery with a newborn. Story 14, you can lose your teeth or your teeth will decay easily. Like no matter how well you brush, floss, rinse, etc., you will end up with cavities every time you see the dentist. Story 15, nausea during labor, especially during transition. If you don't want to, you can have Zofran, super easy and very low risk, will keep you from puking on top of everything else. Story 16, pregnancy-wise, the heartburn, oh my god, probably one of my worst symptoms, plus not being able to eat anything tomato-basting pizza and pasta was devastating. Story 17, the intense night sweats after giving birth. This doesn't happen to every woman, and it didn't happen to me until about a week later when I returned home from a hospital, but every time I would fall asleep I would wake up drenched in sweat. I'm talking, able to wring your clothes out wet. Story 18 regarding childbirth. The pooping during delivery was a secret 21 years ago. Everyone probably knows now, but I was surprised, horrified. And as for pregnancy, I had no idea you could actually grow out of maternity clothes. Almost nothing fit me by time I gave birth to my first. I had gained 60 pounds. Don't worry, I was only 100 before pregnancy. Seems like I needed the extra weight to carry a 10 pounds baby. Story 19 teeth loss is not uncommon. You know those nightmares about your teeth being loose and wiggling out? That can actually happen during pregnancy. It's not uncommon. Story 20 you go from having so much medical attention monthly, weekly, even daily visits to your OB at the end, to absolutely no support after you give birth and are discharged. No one cares how you're doing, and you get no medical attention until your 6-week checkup, to see if you're ready to begin meeting the needs of your spouse. It's just gross how women are treated by the medical community. Story 21 that it's life-threatening. I was sick throughout my pregnancy, to the point I had 2 stints in hospital on drips anti-nausea medication, that almost killed us both. Then the birth 2 months early was traumatic, also nearly killed us. I lost almost half my blood, required several blood transfusions, and spent a month in hospital. Our daughter was in a neonatal unit for 2 months, was allowed to bring her home Christmas Eve, weighing 4 pounds 10 ounces. My late husband, who was a Royal Marine, had PTSD from the birth, and he had seen combat by then. He was killed in action when our daughter was 17, missed her graduation to become a DR at a children's hospital, her getting married, having twin girls. His photo is everywhere in her house, which is tough going for me, even 20 years on from his death, but she was worth all the trauma. Her dad would be so proud of her today. Story 22 not a woman, but the baby having the father's blood type was an unexpected pregnancy risk. She had to get the Rogram shot. Crazy how many women may have either lost a baby because of it or run the risk of losing it not going to the doctor early on. Story 23 as a husband who watched his wife go through pregnancy twice. Women don't talk nearly enough about how hard that whole process is. I was already a big feminist, but I never been a bigger one after watching my wife give birth for the first time. I think a lot of women just take it on the chin because it's what you're supposed to do, but me as a bystander, I lost years of my life watching my wife go through everything. Also, it differs so much per pregnancy that you will almost never get the same experience. I also think that dudes that cheat on women after birth or tell them to get in shape should be imprisoned. Story 24 how physically strong you need to be pre-baby and during pregnancy, in order to be able to have a decent recovery. Unfortunately, your hormones and how your body reacts to them will play a big role in the recovery, but the stronger you are the better, and also PPD, the sudden hate, rage and helplessness. Story 25 how your body reacts is going to be so predictable and yet so unpredictable, like yeah, lots of the stuff you'll see coming, and then you might get some random side effect that's the exact opposite of everyone else's experience, like your insomnia being cured. It really is a whole roller coaster you absolutely cannot predict. Completely ill. Story 26 that it's also totally normal to have 0 symptom and have a healthy pregnancy. I was worried sick when I had no symptom other than growing belly. Story 27 at least for American women an epidural is not your only pain management option. There are medications, nitrous oxide gas, and of course birthing positions which can all be used. The gas is amazing. BTW. Contractions can sometimes be felt in your legs, without abdominal pain. Each woman, and each pregnancy, can be different in terms of how contractions are felt. Story 28 how horrible some women feel when their birth doesn't go as planned. How jealous and sad you feel when hearing about someone who had the birth you wanted but didn't get. Story 29 nobody tells you about the identity loss you experience after having kids, and it sticks in for a while until you discover the new version you have became. Story 30 hey race one that happened to me, and apparently 3 of other pregnant people. Pelvic varicosities, or varicose veins in your pelvic region including inside your vagina which can burst when you deliver the baby. I had at least 2 varicose veins inside my vagina burst when my daughter was born, the moment she left the birth canal. The friction of her sliding out tore open the varicose veins and I nearly bled to death after an extremely low-drama pregnancy and labor up to that point. The torn veins also contributed to a very extensive but superficial tear almost into my anus. I needed 30 stitches to fix me up, inside my vagina, and all down my perineum. Luckily, I had no muscle involvement, and my continence was never affected. Story 31 that you basically get abandoned after you give birth because it's all about the baby. Family doesn't care, friends don't care, your own nurses ask more about the baby than you. It's so sad and we wonder why moms get depressed. Story 32 postpartum, especially the newborn period, is insanely hard. I was so worried about the pregnancy and the birth, and then they handed me this tiny fragile creature, the most precious and valuable thing I have ever had, and said it was time to take it home. I was somehow not prepared for the terror of that. Birth is a day or days tops. But also, man did I feel incredible after those miserable months of pregnancy. Story 33 not about pregnancy birth, but about the after postpartum period. Nobody ever talks about it, but as someone almost 2 years PP you still get phantom baby kicks. Sometimes that'll scare the out of you randomly. Didn't start until about 6 months PP when hormones started settling back down, but it's absolutely wild and makes you second guess every period you have afterwards. Story 34 I'm going to pick a weird one because I was speaking with someone it happened to. You can suddenly become deathly allergic to something you have never been allergic to before. The person I was speaking to had consumed dairy her entire life. When she was pregnant, she was apt to consume dairy through most of it. Towards the end, she was sent to the ER after having a glass of chocolate milk. She found out that even after she gave birth, she was still allergic to dairy and said she missed it every day. Story 35. If you get induced with Pitocin, then get an epidural. Even if you have high pain tolerance, it still may not work, and be prepared for that. Especially if you have the redhead gene, you may think you're going to die from the unyielding pain, but eventually the baby will come out and everything is okay again. Ask me how I know. Story 36. Dysphoric milk ejection reflex or DMARE. I would get it and it was so strange. I noticed a pattern of these feelings of dread whenever I would breastfeed. I hated breastfeeding because of it. Story 37. When your water breaks, it's like a complete gush everywhere. Before my pregnancy, I thought they must add water tubes during the 3rd trimester and didn't realize it was natural too. They don't put the baby in the nursery like in movies. They put the baby beside you and the child screams 247, so you can't sleep at all. Story 38. Just how many weird symptoms can crop up? I got gestational carpal tunnel, and I was like, this is a thing. The temporarily increased amount of liquid in your body squeezes the median nerve as it passed through the carpal tunnel. And no one ever explained this one to me, but during the last trimester, I totally lost the ability to feel the air temperature and the ability to tell if I was hot or cold. It lasted until about 5 months postpartum. Story 39. After a certain point in your pregnancy, it's this fun game of is this pee, my water breaking, or discharge. For the rest of the 3rd trimester, I had to wear those disposable underwear diaper things because my baby would kick and I'd pee myself a little bit. Story 40. A happy one. I didn't realize until my 2nd pregnancy babies move differently. My first was a kicker and would regularly get hiccups. He was always moving. The second hardly kicked, but she liked to stretch and roll. Also when they get big you can see them move. I remember the horror in a colleague's face when he happened to glance over as a little foot pushed out and traveled down my stomach. Story 41. Pregnancy is like second puberty. Growing, mood swings, body changes. Postpartum is like early menopause. Hot flashes, night sweats, hair loss, mood swings, body changes. Story 42. 1. The bone-weary exhaustion of pregnancy. I was prepared for nausea, not the utter exhaustion. 2. I stopped sleeping through the night in my 1st trimester because I had to pee so often. 3. Pooping during birth. It will happen. You care a lot before labor and not at all when you're in the midst of things. For bleeding for 6 weeks postpartum. That pissed me off so much. I was so unprepared for a 6-week period on top of recovering from childbirth. 5. Even if you get back to your pre-pregnancy weight, it all ends up in different places. Story 43. A positive pregnancy test does not guarantee a baby. So many people think that pregnancy equals a living, breathing infant. That is not always the case. I know I've had 5 pregnancies and no living kids. To have the joy of a positive test snatched away from you, and to be filled with dread at a positive versus excitement and hope, is quite the experience. Story 44. I did not know, until right before my first delivery, that one will bleed heavily afterwards for quite some time. I guess I thought once everyone was hosed down at the hospital, that was it. I had read many first-hand accounts of childbirth before I came across this nugget of information. Story 45. Dropping the pregnancy weight is not the same as going back to the way you were before. Breastfeeding can be difficult and frustrating. You may stay the size of basketballs. Story 46. Just gave birth. I knew automatically when my waters broke because there was no denying the obvious balloon pop sensation. What nobody warned me about was with every contraction I gushed more liquid out. It wasn't a one-time gush, made getting to the hospital harder because I wasn't sure how to contain the gushes. My husband slinged me with a towel between my legs and helped me walk with a crotch sling. There was no denying what was happening when I got to the hospital front doors. I also broke out in tons of tiny little skin tags all over my neck and chest. They're little and can't see them but I can feel them, apparently a normal pregnant thing. Story 47. If you have a parenting partner, they will show their true colors. Some men can be good or okay partners without children, and pretty terrible partners with children. They can't cope with the added workload, lack of time for themselves if they actually help parent, and not being the focus of your attention. It can be a surprise and it really sucks to learn at such a vulnerable time. Story 48. When pregnant, you're watching the due date thinking your end goal is the birth, as though everything will just go back to normal then, but really nothing will ever go back to normal and the birth is just the beginning of a marathon. Story 49. You need to be vocal about what you need help with. Your partner has no clue what to do either. They need instructions and insight. This will alleviate your resentment and the buildup of anger. Your sanity depends on your ability to communicate. Story 50. I love reading these types of posts. Cements in my brain that as a 31-year-old woman, I am never ever having children. These comments are horrific. Story 51. Pregnancy and childbirth can come with a honeymoon period during the pregnancy and after the birth. They always talk about how hard it is on a partnership, and it is, but my husband and I get closer during pregnancy and felt more flirty and in love than ever after the birth of our first. We'll see how it goes with our second. Story 52. You may not instinctually know what to do, and may spend an immeasurable amount of time trying to figure it out. Being pregnant is not always fun. In fact, when it isn't fun, it is a misery you cannot escape. Being miserable does not equate to ingratitude, or weakness in any form. It's just not something that's talked about often. Unfortunately, pregnancy is 100% subject to toxic positivity. and those that tell you it was the best time of their lives, or that it's a wonderful experience or seeing it through rose-tinted glasses. The experience was extremely rare, or simply don't want to share any negative experiences in fear of scaring you off or appearing ungrateful or negative themselves. Also, every pregnancy is different. For example, I've had 3 kids and each pregnancy and my state of mind were completely different. Personal examples: my first pregnancy was a breeze, slightly uncomfortable at times, but I more than made up for that with a very long and excruciatingly painful birth. My second pregnancy was very exciting, slightly complicated, and the birth was very scary and got complicated very quickly. My third pregnancy was miserable, and dealing with the paradox of wanting it to end every second while dealing with crippling anxiety about the health of my baby and myself was nearly unbearable, and the birth was incredibly peaceful and easy. I learned directly what most are saying in response to this thread. One cannot anticipate how this experience will unfold, no matter how bulletproof the plan seems to be. This also goes for taking care of and raising the resulting baby and child. The best plan is to accept that there cannot be one. Stay open to the experience, and know that this is another season of life that is meant to teach you invaluable lessons on the meaning of life. Story 53. The sheer number of complications that can happen that you're told are normal, as in it happens regularly, are astounding. You can fracture your tailbone during childbirth, happened to me, and to another woman in my mommy and me group. Normal, you can have nerve damage compression during childbirth that makes your legs so numb you cannot move them or walk afterward, sometimes for days, and nerve pain can continue for any amount of time. Normal, happened to a friend. During pregnancy, you can release too much of a hormone called relaxin, which, aptly, relaxes your ligaments to prepare for childbirth, which causes the ligaments in your groin to loosen so much it is extremely painful to try to use them, making it impossible to even roll over in bed or get out of bed without pain. You need to use your hands to lift and move your legs out of bed. Normal, that one was again me. Pregnancy can trigger autoimmune conditions that you did not have before, like Graves' disease, which then are lifelong conditions. A friend of mine has that one, and these are not hypothetical things that can happen. These are just examples from my own circle of friends, and I really don't have that many friends. I know far fewer women who came out of pregnancy and childbirth without some astounding complication than those who had something pretty huge, because we as a species need to do this to survive. Everything just gets called normal like it isn't totally debilitating and completely horrible to go through. Imagine a society where every man has their right arm chopped off at 18. Just because everyone goes through it doesn't make it less painful or horrible. Just because every procreating woman goes through childbirth doesn't make it not traumatic on your body, but it's not seen that way. Story 54. Not one person told me a thing about PPD, not one, and I thought I was nuts. I had no idea. This was 1983, they called it the baby blues. No one told me that I might want to kill myself in the shower and that I needed to seek help, and that I wasn't nuts. Story 55. At no point in my classes during school did they mention tearing from vagina to or the existence of the husband stitch. Thank you, internet. I'm not having any kids, so very glad I don't need to be concerned about that. Story 56. From the father's point of view, during delivery, do not give her your hand to hold, wrist, forearm. Fine, hand, bad idea. My wife nearly broke mine, not that I blame her a bit. Story 57. Your husband partner will very likely leave you. The high percentage of folks who realize they're in too deep is astonishing, and it doesn't matter if you vowed through sickness and health or that you've known them for so long so well. Having a kid messes with not just the brain of someone having a baby, but the other responsible person as well. The difference is they can just leave you with this new life to take care of, and live their life regardless, to listen to your body over the advice of a doctor. I gave birth at Yale, which is a teaching hospital, and I lost count. How many doctors told me I was going to be there all night or even a few days? I tried to tell them multiple times. I felt immense pressure and felt like I needed to push, and they ignored me, not dilated enough. Their little textbook said I'm not ready, so I guess I'm not ready. Nobody told my son that though, and he came out less than half an hour later. Delivered him myself. Story 58. That even with an epidural, you're going to feel transition, baby head coming through. All 3 babies I had an epidural. All 3 worked great until it came to the final moment of push. The head, there is a sharp pop that I feel, even with the meds going. But then it's so quick the shoulders follow and the baby is out, and suddenly there is the sweet beautiful baby grabbing at your chest and making the sweetest sounds, that you forget about that pain in the moment. Each baby transition surprised me. I thought I would get slightly used to it by last and final baby 3, but nope. Just as intense each time and just as quickly forgotten when I got my baby in my arms. Story 59. I didn't know that I would vomit after getting the epidural placed. That was unexpected and went everywhere. I was crying and apologizing to the nurse who held out her hands for my puke. The LD nurses are angels. Story 60. That no matter how awful your birth is, once baby is born, in many ways you're pretty much on your own for all of your self-care, including getting yourself to the bathroom, advocating for yourself and baby, etc. Oh, and most men are pretty S-partners postpartum. There are obvious exceptions, but it's an amazing opportunity for the worst to come out in a lot of them. Story 61. After reading all the comments, I can safely say I 1000 want nothing to do with pregnancy at all in my life and solidified my fear of ruining my body if I went through it. Glad to learn about pregnancy and childbirth before I do anything stupid. Thanks for the info, everyone. Story 62. People tell you cervical checks aren't necessary. They are if you want them to admit you to the hospital. I refused cervical checks at first. I knew I was in labor. I was screaming in pain from contractions every 2 minutes, but they said unless I let them check me and am 6 centimeters dilated, they wouldn't help me. I told them I was assaulted in the past and wasn't comfortable with it. They wouldn't let my husband be with me yet either, so they waited until I gave up that fight. I let them do one and it was the worst part of the entire experience. It hurt like and I had to have them stop before they felt how dilated I was. The doctor finally came in and said we will give you fentanyl and an epidural. Once I got that, and they let my husband be with me, I let them do another cervical check. I didn't feel a thing. I was 6 centimeters. Delivered my baby 8 hours later. If men were the ones who gave birth, there would be like 500 people on the whole planet. Story 63. You are growing 2 new bodies minimum. Yours and the baby's, your body, your brain, your emotions. Get ready for a whole new person to come out on the other side. You just might like them or not. Oh, and sometimes the baby don't like you. It took a year for my oldest to tolerate me. She only wanted daddy. Story 64. Be ready if there are complications. They are going to lay there and let you suffer for way too long. Make sure your person is ready to advocate for you. Story 65. After my C-section epidural, I could not pass gas and it hurt so much they put a tube in to release the buildup. That is apparently very common. ID never heard of it. Story 66. Emergency C-section that you will be shivering cold uncontrolled, and it is another level of mind FK to feel your body pulled side to side being numb, so you know there's supposed to be pain. Until the numbness wears off, there's traumatic levels associated with my unexpected emergency C. I wish more told me or warned me about. Story 67. No one warned me you can get varicose veins in your vulva when you're pregnant. They are excruciatingly painful and may or may not go away once you give birth. If not, you have to have them stripped. Story 68. The struggle with breastfeeding. I thought you plopped the baby on me and that was it. It was such a struggle with all 4 of mine. I ended up switching to formula faster with each one. With my last 2 I was homeschooling my oldest too, so it was just easier to use formula. It made me so sad. Story 69. Yes, an epidural really helps, but putting it in all 3 births for me was awful. Not to scare anyone, but all of them felt like electrocuting snakes crawling through my back. Think it messed me up permanently. No, I am the odd one out though. Story 70. How tired I got after my unmedicated birth. It was blessedly quick, but afterwards all I wanted was to sleep, and really felt guilty for not being fully present for the newborn. Story 71. This is weird, but I feel like they don't tell you you really might not while giving birth. Like, look, I get it, it's better to be prepared, but I thought it was an inevitability. I watched both my births, saw videos, had a mirror up, it just didn't happen, and I remember in my haze during the first I was like, hey, aren't I supposed to? Is it okay that I didn't? And my midwife laughed for a minute and was like, you haven't eaten in 36 hours, and you spent the first few hours of those contractions on the toilet. If I recall, what did you think was left inside of you? And I felt extremely stupid. Also, nothing prepared me for the pain of breastfeeding. Like, I knew it hurt, but I wasn't prepared for agony and bleeding on day 1. Story 72. Contractions are far more painful than pushing the baby out. Why did I spend my whole life fearing pushing a baby out my vagina when that's the best part? Story 73. That the baby can just start going out without your active pushing or any control. You literally can't stop. It's like a truck hit you from the inside and is trying to get out. Story 74. How humiliating and dehumanizing it is. If you want a baby, and even if you don't want it now, you have to allow everyone that went to medical school and wants to look at and touch you. Story 75. That it is normal not be glowing and happy during pregnancy. I was really thinking there would have been something wrong with me because I was not glowing and always happy and really moody. Story 76. What surprised me when having my first was you get a catheter with an epidural. All the blood that comes out when you stand up for the first time. It was really scary. Story 77. It felt like my organs were going to fall out of me every time I stood up for the first couple of days while things were settling back into place. Weird feeling. Story 78. If you're planning to get an epidural, say yes when the nurse first asks or request it before you think you need it. Don't wait. The anesthesiologist is busy and it takes time for them to be found and notified about you, and then they may already have other patients before you to administer the meds to. There really is no sense of urgency from the nurses or the anesthesiologist to get your pain meds administered if you're not emergent, and maybe even if you are emergent. If you wait until you're ready, you may be in a world of pain well before you get the epidural, or may even be too far into labor to qualify for the epidural. If only I had known this for my first pregnancy. Story 79. Nobody tells you that when you stand up after giving birth, you can feel your organs moving back into place. So not only are you getting used to jelly legs, your old center of gravity, you're feeling all that going on too. Story 80. When your milk comes in and your breasts get engorged with it, that you can shoot it like a super soaker if you squeeze that was hilarious. Also, invest in nipple pads for milk leaks. Story 81. That during birth your body can go into shock with full body shakes, feeling cold, and throwing up. I didn't know it going in for my firstborn and was very confused what was happening until a nurse said it was completely normal. I was more prepared for it with my second-born child. Story 82. No one told me that my nipples would turn 9 shades darker and grow to twice their size. I've known 40 women who have given birth and not one has ever mentioned it. Story 83. No one told me there's a thing called back labor. I always assumed contractions feel like really bad cramps period pain. Back labor is seriously like getting stabbed in the back with a hot poker without any breaks or relief. and when it started I had no idea I was in labor because I had no pain in my uterus area. It took a midwife saying I was 4 centimeters dilated to understand I wasn't just having the worst pain in my back of my life. Story 84. After the baby is born, you get superhero hearing. It makes going to movies obnoxious for a while. You'll be able to hear gentle baby coos from 2 floors away between 3 walls. Also high alert status for crying from any child, along with a super high frequency to understand what kind of cry: fun, sad, hurt, hungry, tired, scared, who is crying, and have the ability to procure your way to them fast if the situation calls for it. There's a reason you can see the videos where a parent somehow backflips over a car to catch a kid from going into the street. Also, it is inevitable that your kid will fall downstairs, usually a lot of them, and they'll be head over tea kettle. And somehow, after some good hugs from their favorite person, check the pupils, move the wrists and ankles, etc., they'll be absolutely fine. Babies, toddlers are unbelievably resilient. Those bendy bones go a long way. Story 85. Honestly, I never imagined I would miss being pregnant. I loved the feeling. I had a rather easy pregnancy by comparison to some of my friends. Because I was older, had my baby at 42, I was so consumed with worry, and every time I didn't feel movement I panicked. I wish I could have enjoyed it more. I loved feeling my baby move around and kick. It was magical for me. The epidural had me vomiting for 6 hours after. That part sucked. Also the constipation near the end was absolutely brutal. Story 86. By depends or always discreet diapers for yourself. It's so much better than what the hospital gives you, and you'll be laying sitting for most of your time there. Story 87. The epidural may not work. My first did not, and the second one leaked. I had to have a blood patch where they took 20 ccs from my hand to put in my spine or something like that. I have tiny, weak veins that barely get 1 vial from my arm before I just tell them to use my hand. I had to lean over perfectly still while they did the blood draw when all I wanted to do was hold my baby. But that seemed to work, so I was finally able to move. Huge shout out to the nurse who listened when I said I couldn't sit up. The second delivery was so much easier, epidural worked, and I was walking out the next day. Story 88. I read every book and blog on labor and newborns and babies and toddlers and parenting, etc. I felt super well prepared. I skipped postpartum entirely. I had absolutely no idea you bleed for 6 weeks after birth. I didn't know my hair would fall out or I'd go through wild hormonal swings and sweat like in church. I had no clue I wouldn't just magically snap back to my old self, and I don't mean losing baby weight. I mean motherhood changed me at a deeper level, and I completely lost track of myself, because suddenly I was someone I didn't recognize, etc., etc., etc. Now, people talk about that stuff on TikTok. They make reels of wearing mesh undies and pads so big they seem cartoonish with still swollen bellies in hospital bathrooms. They talk about getting their pink back. I wish all that had been around when I was in my 20s having kids. I felt betrayed and blindsided because the women in my life didn't share any of that insider knowledge with me.